Hello and welcome back to our channel, where we give information and education on women health conditions. Today, we are going to talk about heavy menstrual bleeding. Heavy periods, also called menorrhagia, is when a woman loses an excessive amount of blood from her womb through her vagina during several consecutive menstrual cycles. This may happen approximately every 24 to 35 days, depending on the length of the menstrual cycle. Menorrhagia can occur by itself or in combination with other symptoms, such as very painful periods. Heavy menstrual periods affects about 1 in 10 women. It does not necessarily mean there is something seriously wrong, but it can affect a woman physically, emotionally, and socially, and can cause disruption to everyday life. How do I know my periods is heavy? It is difficult to define exactly what a heavy period is, because the amount of bleeding during a period can vary considerably between women. It is usually considered normal for a woman to lose about 30–40 ml, about 1.35 Oz, during a period, as about 90% of women will lose less than 80 ml over a maximum of about 7 days. It is quite difficult to know how much 30 ml or 80 ml is when sanitary towels or tampons are used over 3 to 7 days of bleeding. Therefore, other ways of assessing the amount of loss are common. It does not have to be precise and accurate. Most women have a good idea about how much bleeding is normal for them during their period and can tell when this amount increases or decreases. In general, any amount of bleeding that disrupts everyday life, causes flooding, or passage of large congealed blood clots, or needing double protection of tampons and towels together, will be regarded as heavy. Do visit your doctor or specialist if your periods are heavier than usual or if they are disrupting everyday life. What are the common causes of heavy menstrual bleeding? Common causes of heavy menstrual periods may include hormonal imbalance, dysfunctional uterine bleeding, uterine fibroids, endometriosis, adenomyosis, pelvic infection, polycystic ovarian syndrome, medical conditions, low thyroid hormone. If you are over 40 years, your doctor will also want to exclude other causes such as endometrial hyperplasia or polyp or cancer. Most likely, a pelvic ultrasound will be required. What treatments are available? As the amount of menstrual bleeding varies considerably from one person to another, it is common for many women to suffer for a long time without realizing the need to go for help. Therefore, menorrhagia is not always diagnosed. Once menorrhagia is diagnosed, your doctor will discuss all the possible treatment options with you. Medications for heavy periods. Medical treatment is often started while waiting for results of further tests, if in the first instance there are no symptoms or signs that suggest a serious underlying cause. Trying this for a couple of months should help determine if it is likely to be effective, at least in the short term. If a particular medication is unsuitable or ineffective, another one may be recommended. The different types of medication that are used to treat menorrhagia are 1. Tranexamic acid. Tranexamic acid tablets work by helping the blood in the womb to clot, reducing blood loss by 20 to 60%. Tranexamic acid tablets are taken after heavy bleeding has started. They are not contraceptive, and they can be combined with a non-steroidal anti-inflammatory drug. Side effects include indigestion, diarrhea, and headaches. 2. Non-steroidal anti-inflammatory drugs, such as ibuprofen, menamic acid, or naproxen, have been shown to reduce blood loss by 20 to 50%. They are taken only during heavy periods. They work by reducing the body's production of a hormone-like substance called prostaglandin, which is linked to heavy periods. NSAIDs are also painkillers. They are not a form of contraceptive, but they can be used with combined oral contraceptive pills. Possible side effects include indigestion, heartburn, and diarrhea. 3. Combined oral contraceptive pills contain 2 hormones, estrogen and progestogen, with the benefit of regulating menstrual cycle and reducing menstrual pain. They work by preventing your ovaries from releasing an egg each month. This means that the whole menstrual cycle will be modified, so that the lining of the womb is not built up like in natural cycles, so the bleeding will be much less. Common side effects of the combined oral contraceptive pill include mood changes, headaches, nausea, fluid retention, and tender breast. 4. Levonorgestrel-releasing intrauterine system, The levonorgestrel-releasing intrauterine system is a small silicone device that is placed inside the womb and slowly releases progesterone hormone. It prevents the lining of your womb from growing quickly, and it is also a form of contraceptive. It can reduce blood loss by 70 to 95% and is the preferred first-choice treatment for women with menorrhagia, unless its use is contraindicated. Possible side effects of this method include irregular bleeding, breast tenderness, acne, headaches, and amenorrhea. 5. Gonadotrophin. Releasing hormone analogues are a group of medications that work by stopping the ovaries from producing the sex hormones, causing medical menopause. This way, there is no stimulation or build-up of the lining on the womb, so there is very little or nothing to shed from the lining of the womb during menstruation. They are often used while the patient is awaiting surgical treatment, such as endometrial ablation, hysterectomy, or myomectomy, uterine fibroid removal, and in cases where the heavy periods are because of adenomyosis or endometriosis. They cause bone thinning and therefore cannot be used for more than 6 months without hormone replacement therapy. In addition, they cause hot flushes, night sweats, dry skin, and menopause effects. 6. Oral progestogen, like norethisterone or desogestrel, work by preventing the lining of the womb from growing quickly. It must be taken as directed by your doctor. Norethisterone is not an effective form of contraception and can have unpleasant side effects, including weight gain, bloating, breast tenderness, headaches, and acne. 7. Injected or implanted progestogen. This works like any other progestogen, causing endometrial thinning. An example is medroxyprogesterone acetate, which is also a potent form of contraception. It may cause a delay in return of fertility for up to 18 months. The side effects of injected progestogen are similar to that of oral progestogen. The injection is given once every 12 weeks, for as long as treatment is necessary. 8. Medical treatment of any underlying cause. For example, some women have heavy periods because they have low levels of thyroid hormones or hypothyroidism, or because of bleeding disorders like haemophilia, or they are on blood-thinning medication. The treatment of their heavy periods will depend on effective treatment of the underlying medical problems. Now let's look at why surgery may be required for the treatment of heavy periods. Your gynecologist may suggest surgery if medical treatments are not effective in controlling the heavy periods. There are several types of operation that can be used to treat menorrhagia. If the underlying reason for the heavy periods is that which demands surgery, then the surgery is as it is for that condition. For example, as in menorrhagia caused by uterine fibroids. These are hysteroscopy, dilatation and curettage, removal of polyp. A camera is inserted through the cervix into the uterine cavity, and a scrapping of the cavity occurs, mainly for testing the specimen obtained. This may improve the heavy period, but this is not usually sustained. Therefore, it is strictly not a treatment option. In some women, however, following this procedure, especially if they had excessive growth of the lining of the womb, that is not associated with cancer or precancerous condition, there may be a lasting improvement in symptoms such that medical treatment become a suitable effective option. Some polyps can cause heavy periods if they occur in crops, and it may be possible to remove these during the hysteroscopy. Endometrial ablation, where the womb lining is destroyed using various techniques and devices. In microwave endometrial ablation, the probe that uses microwave energy is inserted into the womb to heat up and destroy the womb lining. This procedure will cure or improve heavy periods in about 60–70% of cases. These procedures can be carried out under local or general anaesthetic. They are quick to perform, taking around 20 minutes, and you can often go home the same day. Hysterectomy, surgical removal of the womb, which may sometimes also involve the removal of the cervix, fallopian tubes, ovaries. Hysterectomy is fast becoming the last resort as a treatment option for heavy periods. This is because there are often other less invasive and effective treatments. Apart from the complications and the longer recovery of hysterectomy, the satisfaction rate of this surgery to treat heavy periods remains high. Hysterectomy is now commonly done as a keyhole operation, but in several parts of the world it is still done through an open cut in the lower abdomen. Uterine artery embolization. This minimally invasive procedure is done by inserting a small tube through the groin blood vessel and then following this to the blood vessel that feeds the fibroid and uterus. Once this has been achieved, small plastic beads are injected into the arteries supplying blood to the fibroid. This blocks the arteries and causes the fibroid to shrink over the subsequent 6 months. This treatment is only useful if the fibroids are the main reason for the heavy periods, avoiding the need for a hysterectomy or myomectomy. High-frequency ultrasound therapy is an emerging method of treatment of uterine fibroids. Myomectomy is the operation for the removal of fibroids in the uterus. Less and less of this surgery is being done for small fibroids. Very large fibroid can be treated through this operation, especially if the woman still wants children and is not suitable for a uterine artery embolization. If your periods are very heavy, do make an appointment with your doctor or gynecologist to discuss this further. Thanks for watching, and if you found this video helpful, be sure to like, share and kindly subscribe to our channel to allow us to continue to make more content like this one. And if you find this interesting, you will also find more or our displayed link videos interesting as well.